Please state your name, who you represent, and your position on the measure.
Yes, Madam Chair. I'm Tommie Farrell. I'm a physician. I am from Hendrick Hospital in Abilene, Texas, and a part of the Texas Hospital Association, and myself, and representing in favor of this bill. I have some credentials I could list on the state and national stuff, but most important is exactly what Dr. Casanova said, that I've been with thousands of families for the past 17 years and making these very difficult discussions. And I would endorse actually every he said, except I can also say that's what we do in West Texas, in the hospitals I've worked with in Lubbock and Abilene, that we're really trying to do right by patients and families, and we need to make sure we preserve that. In response to one statement made about the surrogates always being the best person to represent the person, we've had cases where our surrogate will even say to us directly, I know my mom wouldn't want this, but I'm going to ask for this. And it's based off very important personal needs on their end. We recognize that suffering. I mean, Ms. Holman shared that very poignantly on how hard it is on a personal level to say, yes, I know what my dad wanted, but now you're asking me to say it over and over again. And so sometimes the choices aren't based off the patient's needs, but based off that person's emotional needs at the time. So for that reason, we're for this bill, and I can answer any questions if you have questions for another physician who does this every day. I won't answer much different than Dr. Casanova, but just do it in West Texas speak if you need it.
Members, any questions? From your perspective, how did things change in the clinical area when the law changed?
Very similarly, especially for my ICU partners, and I work a lot with ICU doctors and oncologists directly, and things that were pretty straightforward for them beforehand became calling me up and saying, Tommie, what am I supposed to do with this now? This family member saying this, and according to this, they can't even when the family member puts something in place, then all of a sudden they couldn't be in a spot to change things based off some of those wordings. And so it became a lot of confusion in helping them step through, making sure we were keeping the intent, which in the end, we were just trying to make sure what was this patient's wishes, were it clear, have circumstances changed, because we agree if circumstances change, we need to take that into account for the way this patient would make decisions. But if a patient has a very express wish and circumstances haven't changed, we would like to try to keep to that wish. And that was not clear with what came about with the legislation last time.
Yeah, I recall when that bill passed, and what I recall is it seemed to be in response to DNRs being placed on charts that the patient and the family didn't want.
Correct. That was the intent. That was the intent. Now I don't feel like that, at least where I've practiced, it doesn't happen. You really check with patients' families, but if it does, I agree. And that's where I go back to what we want to make sure is, what we want to make sure on our end as physicians helping these families is what was the intent of this person. And it helps them much if we say, if I was able to say, your mother talked about this with us. I was in the cancer center talking to her about this in the weeks past. This is what she intended. We want to help you honor that wish. How can we help you with that now?
Okay, members, any other questions? Thank you.
Thank you.